So we are going to talk about assessing our fascia. Fascia is the connective tissue that covers and interweaves through our muscles, organs, and really all over our body. And there are a number of ways we can assess it, and we do this in order to get an idea of where to focus our self-care work so that we're not spending all day working on our entire bodies. We can focus on the areas on a day-to-day basis that need our additional or extra support, and then once a week or so do a whole body routine. Now, the first way that I like to check on my fascia is just by seeing where my awareness is in my body. If an area is numb or I really can't sense it very well, that's an indication that there's likely something going on there. It may be just the nerves, but often the nerves are affected because there's a fascial issue compressing the nerves. So for example, my right arm, I've done a lot of massage work over the years. I've done a lot of writing, and my right arm tends to have less self-awareness and more difficulties fascially than my left arm. So I focus a little more on my right arm. After we have done a self-awareness check or a body scan, and I'll have another video on doing a more detailed body scan, then we can go through and check our range of motion. So for checking range of motion, we're just moving our joints in their natural range and seeing if that hurts, if we can do it, if it's clunky or skips or just feels off at all. If it's nice and flowing, then that's a good sign that our joints are functional and that the fascia around them is not overbuilt. So we can also, aside from using, checking our main joints, we can check if we're able to stretch, especially through our arms and legs, especially through our meridians. I'm not going to go too much into detail on meridians today, but just making sure that you can press your arms and legs out in all directions and get a nice stretch. And when you feel a really strong stretch in one area, knowing that that can indicate that there's a fascial buildup. After we do our stretching, and I have a lot of videos on myofascial and meridian stretching, so you can go there for more support if you need. After we have sent our self-awareness in and checked our range of motion and our stretching abilities, then we can actually physically get in and check our fascia. So what I'm doing is just pinching up my skin and the tissues underneath. Ideally, our skin has some give. We want to be able to pinch it up a little bit. If we can't, then that's a sign that it is bound down by fascia to the tissues underneath. So for my right arm, I know that I have issues there, and I can definitely see on this side area, when I try and pinch up, it doesn't pinch up easily. It comes up in a big clump. Okay? When I pinch my forearm skin, it comes up much easier. And this is common, sometimes when we have weak shoulders or weak joints, our skin will deposit extra connective tissue around them for support. So that's a sign that this joint has likely been weak for a while, since I have a lot built up here. You can check the inside as well, and I definitely have a lot built up in here. It's better than it was. I've done a lot of work on it, but it's still very tight and tender, and it tends to come up in a big clump. Let's compare this with my left side, where I don't tend to have as much issues, and I can definitely pinch up the skin a lot more easily here. Still a little bit tight and tender and clumpy through this area, and so this is actually the large intestine meridian. And so when we have tightness, tension, and clumping of fascial tissue along a meridian pathway, that can be a sign that there's something internally going on along that pathway as well. In this case, the large intestine meridian, it could show that I have possibly some inflammation or even scar tissue buildup around my large intestine. So it's just something to pay attention to. And if you're not addressing that, to talk with your care provider about it And if you don't have a holistic care provider, to let me know, and I will either give you that support myself or help you find someone who can. Okay, so I'm just checking all around, and doing this is not only assessing, but we're getting a treatment as well. When we're pinching up gently, rolling the skin a little bit, we're actually supporting the breakdown of that excess connective tissue. We can go back and do more specific treatments, but this is a great way to warm up. So we're assessing and warming up, or treating all at once. And at this point, I pretty much do this throughout the day. When I have a minute, or if I've been working for a while and I need a break, this is one of the things that I turn to for extra support in keeping my pain levels down throughout the day. You can check your chest. The chest can be tricky, especially in women, because it can be really tender, but it can be great to check the sides here over the pectoralis muscle as it comes out. And there will often be some stickiness in here. So if you have a lot of breast tenderness with PMS, things like that, the upper chest and sides of the chest can be great to work. We can work the sternum and the inside edge of the breast, as well as the outside edge of the breast. We just don't want to overwork the breast tissue, because we have a lot of delicate glands in there. And also, when we overwork the fat tissue on our breast, it can start to break it down and cause sagging. So we want to think about lifting and kind of sculpting our breasts while releasing that tension. And I'll have a more specific instruction on how to deal with myofascial care around the breasts in another video. All right, so we've been focusing on our arms, and I'm just going to keep assessing until I have a good idea of what's going on all through my arm. You can even check the skin. As we get older, another thing that we can do when we check the skin is make sure that when we pinch it up, especially on our hands, that it goes back down right away. If we pinch it up and it stays up for even a couple seconds, that can be a sign that we are dehydrated. And if you followed my work at all, you know that I really stress the importance of deep hydration. So if you find that your skin is showing signs of dehydration, especially if you have chronically dry lips, or you're kind of in a brain fog all the time, you know that you want to up your hydration levels. If that's the case and you can't find the deep hydration post, let me know and I will send it to you. Okay, so we can check our fascia in our belly, and we can do that through our clothes or directly on the skin. So I'm just pinching along the sides of the muscles that run up and down, and I definitely have some stickiness, some clumpiness up at the top here. It's a little better down here, but then when I get to the middle, there's this big clump here, this little pouch that we often get as women, and that's right over our womb. And it's a way of our bodies protecting our delicate womb area, especially if we tend to have a lot of menstrual issues, or we have had pregnancies and given birth. We've had a lot of changes through that area, so there can be some weakness. It may also indicate some instability in the hips and pelvis, because our body will basically create a binder all the way around to support it. So our body will create binders horizontally where there are diaphragms. So we have our chest diaphragm that helps us expand our lungs and exhale. We have a diaphragm at the top here, the thoracic outlet. When it's weak, our body might deposit some tissue going that way. And we have our pelvic diaphragm, or our pelvic floor, which when it's weak, our body may deposit scar tissue there. Okay, so that's the basics on how to check your fascia to assess and see where you need to focus your treatment. I'm focusing on the upper body right now. I will do a more detailed assessment for the hips and legs when I do a video on actually treating with cupping and self-massage and blasting for cellulite care, for cold feet, for spider veins, for leg fatigue, for hip pain. This is just to give you an idea of how to start using our hands, using our brain to scan, and using our movements to assess our tissues. Okay, let me know how it goes and we'll work more with it soon.